Well, thank you. Thank you very much, Dr. Torres. And it is really my great pleasure to be with you here and to welcome you all to Washington. You come, as Dr. Torres noted, you could not have picked a more important time to be here. I mean, this is right now, this month, in fact, even this week, is the time that change for the first time in 40 years, our history is going to be made as we move healthcare reform through the Congress. So I want to thank you already. The members of your organization have been instrumental in helping advise us, in supporting us. Dr. Torres, as he just said, was at the White House yesterday joining physicians from all 50 states. We had at least one physician from every state in the union, in their white coats, actually in the Rose Garden with the president yesterday, standing up for healthcare reform now, because physicians especially know and see day to day what's happening with our healthcare system today. And I also want to thank Dr. Cruz for your leadership, for being just a great partner to all of us in the White House throughout your leadership here. Thank you. And I also want to point out and acknowledge to all of you, Stephanie Valencia Ramirez, who is my staff person at the White House, who particularly works on outreach to the Hispanic community, but she does many other things, housing, immigration, but right now, I have to tell you that everyone in the White House is really focused on healthcare reform. It is the number one priority. We have really had, I think, really fortunate to have within the administration just great leadership on many issues. And I want to acknowledge one person in particular that I know you're going to see tomorrow, and that's Kathy Greenlee, who is the Assistant Secretary for Aging. I met with Kathy actually just last week, and I will tell you that aging agencies and advocates for aging programs could not have a better advocate than Kathy, within the administration. She's someone who ran a state aging agency. She's very close to Secretary Sebelius, having come from Kansas. She's an incredibly thoughtful, in fact, visionary, I think, leader on aging about what the future is for all of us, and is just terrific at talking about that. So I think you'll enjoy meeting her tomorrow. What do I do? So why am I the person who's here this afternoon? Well, I am, as Dr. Torres noticed, the director of the White House Office of Public Engagement. Now, that tends to be like, what's that? It actually used to have an even more cryptic name. What used to be called the Office of the Public Liaison, which was really, what's that? When I first got that. I'm a recent person coming to Washington from Chicago in January to take the job, and it was like, all right, so what does that office do? Well, the president, it is the outreach office for the White House, and the president renamed us in March of this year, recommissioned us with a new mission as the Office of Public Engagement, not just the Office of Public Liaison, and that is to really involve people across the country in the issues that are affecting your lives, your communities, your friends, your neighbors, your clients, your patients, and have you understand that this is your government, this is your White House. We want you engaged in a dialogue with us on these issues. And so I hope that you will continue to be part of that partnership with us as we move forward. And of course, right now, the most important issue, as we've all talked about, is healthcare reform. And to your theme of this conference, of what it means to be publicly engaged and how to speak out, this is the time where it's your voices across the country speaking out in your communities are the most important voices that will carry the day. Because you know the stories. I mean, as people who especially work with aging populations, you understand what's happening in our current system and what's broken. You can tell the individual stories of people that you know who've been unable to get insurance because they have a pre-existing condition, of a couple where the husband maybe has lost the employer-based health care because he's now old enough to get Medicare, but his wife is 5 or 10 years younger, and now she doesn't have health insurance any longer because she's not old enough yet to get Medicare. Or you know the family that has had to pay out-of-pocket expenses that have bankrupted them and spent their life savings. All of those are things that are happening today, and all of those are the reasons why we need to pass health insurance reform. Not next year, not in 5 years. We need to pass it this year. Now let me talk for a couple of minutes about really what health insurance reform means for seniors, because there's been a lot of misinformation out there about what it means for seniors. And it's especially important, as you all know, I don't have to tell you, that the growing number of seniors that we have in our population, and that the nation's senior population is going to double by 2030. It'll make up 20% of all Americans. And by 2015, there'll be 2 billion older people in the world. So that for the first time in human history, when we cross that mark, older adults will outnumber the young. And what that means for as we readjust our economies, but especially as we readjust our health care system. So first of all, health insurance reform is not going to undermine Medicare. It is not going to undermine Medicare. It's going to strengthen Medicare and not undermine it. Now, why do I say that? Because one of the things that health reform will do is get costs under control. We cannot, if we continue on the path that we are on, the Medicare system, in fact, will not sustain the cost growth that we have right now. And so we have to change the cost curve. Now, you've heard a lot about the cuts to Medicare that are part of this, 400 to 500 billion that's out there. But what you need to understand is where those are very targeted, and it's targeted not to cutting care dollars, but it's targeted to cutting those extra payments, the extra amount of money that is going to private health insurance plans within the Medicare system that right now are costing all beneficiaries about $3.60 per month in extra premiums. So that means a typical couple in Medicare right now spends $90 per month in higher Medicare premiums, even if you're not in one of these private insurance plans, for those extra costs. And so that's what we want to get under control. We're not going to affect the care that any senior gets. Well, what are we going to do? We're going to do things like, we're going to cap and contain out-of-pocket costs. So right now, you've got, if a senior needs a colonoscopy that costs $700, you're facing a $140 out-of-pocket payment. That's going to stop. We are going to take care of the donut hole, that piece where 8 million seniors actually lose their drug benefit under the current system. We are going to, under health reform, immediately cut that in half, and then over time close the donut hole completely. We're going to work to reduce, avoidable hospital readmissions. We've got information that nearly 18% of Medicare patients are readmitted to hospitals within 30 days of being discharged. But we know we can do better coordination of care. We can fund preventative services. We can invest in our primary care physicians, who are the people who can help you manage care better and have better outcomes and avoid those costs. And we can have patient-centered healthcare payments with pilot programs that are included in our plan to really knit primary care physicians and specialty care physicians to provide the best quality care overall for our patients. And we're going to reduce wasteful spending. We're going to reduce subsidies to hospitals for treating the uninsured. All of us right now are paying a hidden tax within our premiums for the uninsured who, when they're in a crisis, are going to our emergency rooms, to our hospitals. They're getting care in the most expensive way possible, and we're all paying for that. It's not a humane way, it is not the medically sensible way, and it's not the fiscally responsible way to deliver health care. And so health care reform is about answering all of those issues. And finally, we're going to deal with fraud and abuse. We're going to eliminate, there's a whole series of stepped up enforcement actions we've already put into place. You're already reading about some of the enforcement actions that are returning billions of dollars in overpayments to the U.S. government and that we can now use for care dollars. We're going to continue to do that in health reform. But I cannot stress enough that we cannot do it alone from Washington, and we can't do it from the White House alone. We absolutely need all of you, all of your friends, your family, your physicians, your patients, your colleagues in your agencies to be active on this right now. This is we're in just a few weeks here between absolutely today through till the end of the year where we need this push across the country with people who really want this reform to speak out, because the voices that want to oppose the reform, they don't have another proposal out there, by the way. You know, they just want to stop what's going on. They don't have a proposal for how to get care for people. They don't have a proposal for how to get insurance coverage to the 45,000 people a year who we've now got an independent report that has established are dying because of the lack of health insurance. They don't have an answer for trying to deliver care in a way that will not bankrupt our families and not leave the seniors who have to leave their sons and their daughters with that debt. They don't have an answer for that. And so we are now really on, I think, the verge of this change. The closer we get, the harder it becomes. And the closer we get, the more important it is for all of you to be actively engaged in this and speaking out. If you have questions, if you have concerns, I'm going to give you two little pieces of information on this, and I know Dr. Cruz has it, and the staff here can get it to you. Healthreform.gov or whitehouse.gov. Both of those websites have all the current information. We keep them updated. We have items on there and videos on there that will debunk the misinformation that's out there. And you should always feel free to contact our office at the White House Office of Public Engagement, because we want you to be involved with us. We have a very easy email address, and it's just the word public at WHO for White House Office, .eop for Executive Office of the President, .gov. I hope that you will use that to communicate with us, give us your concerns and your questions. It doesn't have to be about healthcare. It can be about anything that is of interest to you and your community, because we do very much want to hear from you. The President, his charge to me and to my boss, Valerie Jarrett, is that we stay in touch and we bring to him the concerns of Americans across the country. So I hope you will be part of this partnership with us as we move forward. Health reform is only the first stop along the way here. And thank you very much for the work that you're doing. Thank you for having me here, and please enjoy the rest of your conference.